I want to introduce Jennifer J. Burns. She is the Senior Director of the Legislative Affairs at the Arizona Alliance of Community Health Centers to share an update on the dental therapy implementation in Arizona. Go for it. Thank you.
Thank you. At least from what I'm seeing, it looks like the logo behind me is backwards, but you know, the mirror, the fascinating aspects of technology. So I'm going to also add Kristen Bellini at Pivotal Policy Consulting, who's been at this longer than I have, including on behalf of the health centers and so forth. But so we're going to tag team a little bit, but I'll go first. I do represent the Arizona Alliance of Community Health Centers. We have 25 members now, with over 200 sites, and are serving over 817,000 patients. That makes us the largest network of primary care providers, both in Arizona and within Medicaid. And we do a lot of dental, obviously for children, but also for adults. And I heard the question earlier, we are paying that through other operational funds, through grants, and then also something called 340B savings. It's a pharmacy program that brings some funding in. So just answering that from earlier. Going back to dental therapy, this is something that we've been working on. Starting in July of 2023, dental therapists can now be licensed in Arizona. The dental board finalized the rules, finally. I think it took several years, and many of you probably worked on that. By statute, when the dental therapists were created as a workforce in Arizona, they were limited to working at community health centers, or federally qualified health centers is the other term for that, and tribal facilities. We then, the Alliance, received a Pew grant last year to continue moving dental therapy forward. I think Pew had helped to get it through the legislature, and then we received one to help get it through and to keep promoting it with our community health centers, with tribes, as well as with education opportunities to see what we could do to get more and get education programs started and moving forward. So that's one of the pieces we focused on. And then the other piece of that is securing reimbursement with access and getting that done. We met in the process of that with a bunch of education partners, with dental directors. We talked about it with the health centers and others. We also, in December of 23, we hosted a half-day conference with over 45 providers, almost 50 providers and educational partners. One of the things we did with that is we actually brought in experts from Minnesota, both from community health centers that had dental therapists as part of their program, and from training programs, the university and so forth there. And one of the things that was super excited that I think we all left with was great energy, really great excitement about dental therapy, showed a clear need for more educational programs. And something that I think we came out of that I hadn't thought of before was a potential of a Southwest regional education program at one of our aspects, that several of the states surrounding us have the similar requirement for licensing, where you have to be a hygienist before you become a therapist. And so therefore that would provide something similar for multiple. It was also clear in Minnesota that even those programs there were expanding, a couple of them doubling in size of how many DTs they're putting out each year and so forth. So clearly showed there's a need for more education opportunities. It'll still take several years to make that happen here, but at least there was excitement and synergy in moving in that direction. I'll also say that the health center folks that spoke and the provider folks that spoke were also able to convey how much of a difference they've made, how much dental therapists really do help to expand access to care, that it does allow them, the dentist can focus on what they do, and the dental therapist can really help make a difference and expand, being able to treat more people, provide more services, and so forth. We currently are in the final stages of that letter to access to request they start the CMS process to approve dental therapists so they can be reimbursed for services that are within their scope. And then the other thing I want to mention is we also had put together like an employment manual and some other quick help and helpful information if you are interested in starting dental therapy or moving forward on that. We'll work with the Coalition and Children's Action Alliance to get that to everybody on the call sometime next week. And that's what I have. Kristen, you want to add some, because you've been working on too?
So the only thing I wanted to add, hi everybody, it's so good to see so many familiar faces. The only thing I wanted to add is that we're also working with access to allow reimbursement for tribal clinics and tribal 638s and urban Indian health services to use dental therapists and get reimbursed for them. We had a really interesting round and round with the former administration under access. So new administration, And Dr. Rikuber, who was the dental director there, argued that our legislation did not allow for dental therapists to be reimbursed by Medicaid in tribal communities. And those of you who have been involved in this for a long time knew with us during the rules process, but also before during the legislative process, that has always been like the number one issue. And so we had differing opinions with access. So we are also, in addition to working on the state plan amendment and the CMS approval, we're also working with access to ensure that this new administration takes the position that, similar to other healthcare providers within the IHS system, they don't have to be licensed in Arizona. They can move them throughout the country and still be reimbursed. And so we're feeling very good about the new team that we've got over there. There's been quite a bit of turnover within Access itself. And so it's kind of like we've started and then restarted, but we feel like we have a group over there right now who is much more inclined to see the benefit to reimbursing in tribal communities and recognize that the legislation in Arizona actually allows for that.
Any questions?
We don't have any questions in the chat. I do have a question. Do you know of any schools that are going to be starting to train dental therapists yet?
I don't think we can say they're ready to do that. There was definite interest. Again, going to be a couple of years out, you know, some of the ones there, and we can't speak for them. And I know there's some changes going on. AT still was there, was asking a lot of questions. Many of us know, obviously, Dr. Perry. So, because she's normally part of these things. So again, can't speak for them. It was very preliminary. But I think what it really did was it showed there's a need. It showed, you know, again, back to Minnesota, they're doubling. Now, maybe that's only going from a cohort of 6 to 12, but the fact that they were doubling, all of the programs in Minnesota were expanding. And those are the, you know, there's a few others. And Kristen, I don't know if you know if there's been some since then, but go back to that regional aspect that came up, really showed an opportunity for it. And I think some real excitement and synergy. Everybody has to go back and do their own, you know, financial aspects and looking at it and that kind of thing. So that's where it's going to take some time and make some decisions. But I left there, and I think everybody left there with some real excitement that this is possible, this is doable, it's something we need to pursue, rather than something that said, nope, we're done, this is not going to happen. It was definitely the other, like, yes, let's see what we can make happen.
Yeah, it's nice that, you know, we're thinking of the Four Corners area, because that's the big part that needs it. Yeah. Well, if no one has any other questions,
and I'm going to go back. There
go
were
ahead.
others there. I want to go back to, there were others there as well. Community colleges and others that were there as well, and other programs that could be part of it too. So I don't want to say they were the only one.
Yeah. All right.
And I'm sorry, Tamara, I was just gonna tag on to what Jennifer said. I think that one of the real benefits of pulling all those education partners together was the ability to start talking about partnerships, so that it's not necessarily one institution that creates the whole thing, but how does a university partner with a community college who's already CODA accredited to do dental hygiene? How do we, because not only will that help it be more cost effective for the programs, it's going to help it be more cost effective for the students. And I think that's a really, really important thing to keep in mind, is how do we stack those credentials in such a way that one institution isn't doing everything, because that's costly, but also that students are able to benefit from some of those lower cost programs.
That's wonderful. Well, thank you very much for your time. I truly appreciate you coming on and telling us about dental therapy. I hope you have a wonderful weekend. Thank you.
Thank you
Thank
much.
you. We appreciate you.